am Dr. Somnath Garai, consultant pediatrician and pediatric intensivist in Bhagirathi, Neotia, Newtown. Today we are going to speak about a common burning topic, that is COVID in children in this third wave. So obviously we all are, as a pediatrician as well as all parents, are anxious in this situation. So I want to point out few points regarding COVID in children. Most commonly we are getting kids are coming with fever. Sometimes it can be high grade or even low grade fever also we are getting, along with mild sore throat or mild cold, along with some abdominal symptoms plus minus. Usually these are the common symptoms we are getting. Majority of them requires only OPD basis treatment. Some of them are presenting in emergency with febrile seizure, which is again in any viral fever we can get febrile convulsion. So it's not per se as a COVID symptoms, but kids may require hospitalization or observation for these symptoms. Otherwise, for older children, they are complaining of body ache, headache, mild throat pain. These are the main common symptoms in kids. Basically, all treatments are symptomatic. First of all, COVID is a virus, so no antibiotic is going to act against them. And antiviral treatment in general for kids are very limited indications are there. So symptomatically for fever we have to give paracetamol, and in between we can go for tepid sponging. I want to mention that few non-steroidal anti-inflammatory like ibuprofen should not be used by parents as a random basis unless your pediatrician has prescribed it. And you should maintain proper hydration, which is very important during high-grade fever, because kids may land up in dehydration. For sore throat and mild cough, you can use warm water along with honey. No cough syrup is going to act as such, but if your pediatrician is prescribing something, you can give it. Multivitamin, vitamin C as such has no role in preventing COVID, but as a adjunctive therapy you can give it, but obviously not for self therapy. Then if any other symptoms are there, you can consult your pediatrician, they'll prescribe you accordingly. So overall, as such, treatment is completely symptomatic. So most importantly, for parents, which is most important, you should strictly maintain COVID protocol. You all know that sanitization or hand sanitization or hand washing, along with usage of mask and obviously social distance, you should maintain. Then vaccination for eligible age group. Obviously adults, we are not vaccinated, you should get vaccinated. And here I want to mention that common routine immunization of kids that has to be completed as per the schedule, because we should not forget that common illness during this period of time. So please get your kids immunized with a immunization schedule as per the vaccination chart. You can delay a bit if you have COVID at home and you are at isolation, but should not be more than 2 weeks delay. Then for infants who are on breastfeeding, mother has to continue breastfeeding. We are getting many calls. People are asking whether I am COVID positive, we should go for breastfeeding or not. Answer is yes, you should continue breastfeeding, and you can use mask during breastfeeding and wash your hand properly. Here I want to mention those kids with long-term illness like asthma, chronic lung disease, nephrotic syndrome, those who are immunocompromised. You should take proper care and consult your doctor accordingly, because COVID in those cases can be a bit serious. What you should not do, obviously, first of all, no self-medication. Please consult your pediatrician, either physical or you can consult online, and follow their advice. Obviously, do not stop breastfeeding, already I have mentioned. And last but not the least, do not panic. As I told you, this year we are getting less symptoms, though the number of affected children are more. Most of them are getting better on its own. Usually fever is persisting for 3 to 4 days, then gradually they are getting better. So please do not panic, and just use the basic medications and as advised. Now, last but not the least, again, what are the long-term effect? Already in our previous videos we have described a condition known as multi-system inflammatory syndrome in COVID. Usually this affect children after 1 to 2 months after the COVID peak. Now, truly speaking, we do not have any answer that what is going to happen after this third wave, but definitely I am sure we all are together and we can fight and win this war, and we shall overcome. Thank you.